A lot of people in our area are subsistence farmers. A lot of people are surviving on what they can grow and the little bit extra they can sell. People struggle to meet their school fees. They struggle to keep their kids educated, and there's not extra.
It's really hard for them to, one, be able to pay for their health care, and that also makes them difficult to come actually and access the health care, because without what to pay, then there is no need to go to the hospital.
You know, we're here to provide excellent medical care to people regardless of their resources in the name of Christ.
We've seen so many who come without even any coin, no money at all, and we've taken care of those. I think that is the beauty about Kapsowar, that we've never, kept anyone away or sent anyone away because they cannot pay, which is different from other places whereby if they don't have the money, then they will not be taken care of.
I don't know. I just don't think it's fair that some people are born in a country with all the resources that they could want and all the opportunities and all the education, and other people, for whatever reason, they're still born into a place where education is not a given and healthcare is not a given and having a healthy pregnancy is not a given. What else could I be expected to do but help people who couldn't do that for themselves, who don't have access to the education and the resources and all the gifts that I've been given?
Every person really wants to be healthy, and just disease just comes in, and it comes with so much suffering. Jesus saw this suffering, and he had so much compassion for them. And he was so much attracted by this suffering.
That's what the church is called to do, is to enter the hard places where things aren't just and things aren't fair.
There is no more joy than seeing every person that goes through this hospital meets us somewhere and says, "Daktari, thank you. My baby was dying, or my patient was dying, but you did this." It just feels good when you're taking care of these patients that cannot afford anything, and you see how God can use you. There is no much joy than that, and then seeing this smile coming up again. So I think if we are followers of Christ and we want to follow in his footsteps, we want to be him, just like him, we have to have almost a mind like him. Just reminds me of, like Luke 5, when Jesus forgives the paralyzed man. He says, "Your sins are forgiven." And then he says, "You know what? Carry your mat and walk."
I guess the big picture is looking for Jesus in the patients that we treat and serving him by serving them. And someday moving toward healthcare and an economy and a world that's just